In 3, 2, 1, twende. So maybe Waziri could just read to us what it says.
The equipping of this facility with cervical cancer screening and treatment machine was funded by Safaricom Foundation through the promoter scheme and handed over by Edward Wasuna, Area Sales Manager, Safaricom PLC, assisted by Lydia Kerugo Mongare, are the project champion on 14th June 2021. Please clap for them.
Try smile with our eyes. Okay.
Advanced stage, because our people come to hospital when they feel pain, but because cancer of any nature, particularly the one of the cervix, they don't feel any pain until it is advanced. So you find that the mothers who come, they are in stage 4, they are in stage 3, and they are spread all over. Cancer of the cervix is treatable. It's one of the cancers which is treatable. And even in our setup here, it can be treated. If you catch it at an early stage, which this machine will assist us, will prevent the advanced cases, because this machine will help us screen the mothers at the stage which they do not know that they already have a stage which is developing into cancer. So we are very grateful to Safaricom Foundation. It will assist us pick up cases early enough, because if it is caught early enough, it is treatable. But when they come in advanced stage, it is very difficult to treat. So those
is contributing significantly to maternal mortality. And we know that a lot of mothers who come to our facilities, like Dr. Yunga rightly mentioned, come when they already started showing signs and symptoms. Either a mother is having the unusual bleeding, or maybe some unusual pain, or some other signs that they are feeling. Maybe there's some foul smell, and that is the time that they decide to seek medical care. And indeed, in most of our facilities, and also in many other counties, most of these mothers, when they come in those late stages, it is difficult to help them, because then the interventions become a bit more expensive, and the facilities to manage when they get to the later stages of cervical cancer then are not readily available in most of the facilities in many counties, including ours. We have been doing a lot of work around this area of cervical cancer, basically on reproductive health cancers, and we have been working with a number of partners to help us in this. We are now screening for cervical cancer in a number of facilities in our county, and the machine that Safaricom Foundation has kindly donated to us is going to contribute in that effort that we are making to make sure that the mothers who require this service are able to be assisted. Last financial year, that is 2019-2020, in a number of screenings that we did to make sure we detect these cases early enough and assist the mothers, we had close to 50 mothers who had suspicious lesions that needed further intervention. And whatever we could do were done, and the rest, what we were unable to assist, were also referred elsewhere. But that tells you that may just be the tip of the iceberg, because there are many others there that are symptomatic at home or in the villages, and they do not know that they may be having suspicious lesions, they may need care, and if they need care, they do not know where they may need to go to. But with this donation, I think, together with whatever you're already doing in other facilities, then you'll be able to help them much more. Also, the government of Kenya last year rolled out, actually 2019, rolled out an immunization campaign for human papilloma virus that is thought to contribute significantly in causing cervical cancer. So we are currently rolling out vaccination for children who are basically girls who are 10 years, the ones that have not had the sexual experience. And this exercise has been running from last year. We are continuing this year. It's aimed at making sure that we prevent occurrence of cervical cancer in the future generations. So this is an activity that we're already running as a department under a program of reproductive health to make sure that there is adequate protection for the girls in that category that I've mentioned. So we thank you very much, Safaricom Foundation and the team,